Welcome back again to Rhoda Foundation Television. Once again, I am saying thank you for subscribing to this YouTube channel. Thank you for watching the videos that I've made. Thank you for commenting and thank you for all the likes. I really appreciate you. I'm getting positive feedbacks and that gives me encouragement to continue to do this. I thank you for encouraging me and thank you for the support. I really appreciate you all. Thank you very much. The last video, I talked about the risk factor of having breast cancer, and we discussed about 5 or 6 risk factors of having breast cancer. Please take cognizance of all this and take note of them. It's very, very important. Today, we are moving to the diagnosis of breast cancer. How do we diagnose breast cancer? How can breast cancer be diagnosed? Number one is breast examination. We all know what we call examination. Examination is to examine something, and now we want to examine our breast. The first is breast examination is in 2 steps. The first one is self-examination. Self-examination. That is, you yourself, you have to examine your breast. Examine your breast for any lump, for any tumor. Examine your collarbone for any lump, for any tumor. Examine your armpits for any lump or tumor. Examine them by yourself. Examine the color of the skin of your breast for any redness, for any rashes, for any irritation, for any pain. Examine your nipple if they are retracted or has been flattened. Examine for discharges from your nipple, any discharges that are different from breast milk. Please get it reported. Check all your breasts. Examine your breast. After the self-examination comes the second step. And that is when a medical personnel will examine or assess it for you. It is when what you examine and you detected that you will tell the doctor that the doctor will assess you for. The doctor cannot start assessing your breast without you examining it by yourself. Please examine your breast for any pain. Examine your nipple for any pains that are not going away, for retracted nipples, for flattened nipple, for rashes, for itching, for irritation, for abnormal discharges, for lumps, and for tumor. Please examine your breast. After that, you can go to the doctor. If you see anything worrisome there, you can go to the doctor and the doctor will assess again and prescribe the next step for you. Another way of diagnosing breast cancer is by mammogram. Breast is being called mammary gland. Breast is called mammary gland. So mammogram is the photography of the mammary gland. Mammogram is the photography of the mammary gland. That is the picture of the mammary gland. We want to take the picture inside in of the breast. That is the mammogram. And that is supposed to be done yearly or every 6 months as from age 40 or as prescribed by the doctor. It is supposed to be done every year. That is mammogram. Supposed to be done every year or every 6 months as from age 40 or as prescribed by the medical personnel or medical doctor. But there are some cases that you find something in your breast before the age of 40. That doesn't mean you must not report it. But according to research, it says average age of 40, a woman should start doing their mammogram yearly. That mammogram is the picture of the inside of the breast, because there are some things that you cannot test, that you cannot feel from outside. The mammogram will bring it out. Please, women, let us endeavor to schedule the appointment for our mammogram every year. Endeavor to schedule the appointment for your mammogram every year. Mammogram does a lot. And a stitch in time saves 9. Mammogram does a lot. It is being done in a diagnostic and radiology center. It's not being done in the house. It's not being done in the doctor's office. You have to go to a diagnostic and radiology center. That is where a mammogram is being done. And it is advisable to do it every year or every 6 months, as the doctor may prescribe for women from the age of 40. But if you find something in your breast for the age of 40, before the age of 40, please get something to do about it. Another one is breast ultrasound. All these are prescribed by the doctor. When you complain, you found this, you saw this in your breast, then they will prescribe for you, go and do the ultrasound, breast ultrasound. That's to take the picture of inside of the breast, then they can see more what is inside the breast. Another one is breast MRI. Breast MRI. They are very important. The breast ultrasound will be prescribed to you by the doctor for more evaluation. The breast MRI will be prescribed to you by the doctor for more evaluation. But mammogram, please make sure you schedule to have it every year or every 6 months, as the doctor may have tell you. Please, it's very, very important. When you see anything, please say something. When you see something, please say something. Health is wealth. A stitch in time saves 9, and early detection saves life. Thank you again one more time for listening to me. And in my next video, I will continue to talk about the next step after the breast ultrasound, the breast MRI. I will talk about the next step. Thank you for being here. Thank you for being a great support for me. I love you all, and I remain your host, Oluwaseun. Bye-bye.